Hi, my name is Abby Petty, and I've created a presentation for NU 712 Clinical Preparedness and Population Health. The title of this presentation is Primary Prevention of Prostate Cancer. Included in this presentation is a table of contents which is listed on this slide. Please take a moment to review this slide. The objectives for this PowerPoint are found here. Please take a moment to review the objectives of this presentation. The prostate is a gland that is a part of the male reproductive system. It is approximately the size of a walnut that is located below the bladder and in front of the rectum. It surrounds the urethra, which we'll be able to picture on the next slide. The purpose of this gland is solely to produce fluid that makes up part of semen that men produce. This is a picture of the male human body. As you can see, you see the location of the prostate gland below the bladder, and you can tell from the enlarged picture of the gland how the urethra comes down the center of the gland. Now let's discuss prostate cancer. Prostate cancer is the development of malignant cells or cancer cells on the tissues of the prostate. Sometimes this happens as a result of genetics, diet, health history, and other risk factors that we will discuss later in this presentation. Prostate cancer is the second most common cancer found amongst men in the United States. However, most often it is found by mistake, typically by physicians or providers who are performing digital rectal exams. A prostate that is thought to be cancerous on a digital rectal exam typically presents firm, indurated, and enlarged. The only way to be truly diagnosed with prostate cancer is by biopsy of the gland rather than through blood work or digital rectal exam. Before we proceed, let's discuss briefly the levels of prevention. There are 3 levels of prevention: primary, secondary, and tertiary. In primary prevention, we focus on preventing a disease from ever affecting a patient. In secondary prevention, the focus is drawn towards the early detection and screening from diseases. And in tertiary prevention, we are preventing a disease from further progression, often including rehabilitation therapies. The importance of utilizing these levels of prevention in our practices is to protect and maintain the health and well-being of our communities and prevent the breakout of infection that affects total populations, which as a DMP leader is a main priority of our practice. Today in this presentation, we are turning our primary focus on primary prevention, which is often the most important because it focuses on educating populations, which in turn will prevent us from having to move further into the levels of prevention. A few examples of primary prevention are vaccines like the flu vaccine, measles vaccine, and the chickenpox vaccine. Primary prevention means being proactive, and in healthcare there is nothing more helpful and beneficial than being ahead of the game. However, prostate cancer is not 100% preventable, and there is no definitive way to prevent it. But there are things that can be done to reduce the risk of developing prostate cancer and detecting the disease early. Primary prevention techniques used for prostate cancer include avoiding and modifying risk factors, modifications to diet and lifestyle, prostate cancer screenings including prostate-specific antigen testing in your blood or digital rectal exams, also called DREs, as well as annual doctor's appointments. Screenings play a major role in primary prevention. Men at the age of 50 should start being screened routinely unless risk factors indicate an earlier age. A PSA level should be drawn at these screenings to monitor for a rise in levels. An elevated PSA level indicates that there is a problem in the gland, more than likely indicating prostate cancer. A DRE or digital rectal exam is also included in the screening. It requires a healthcare provider to digitally fill the prostate using the finger inserted through the rectum. As discussed earlier, a gland indicating prostate cancer presents firm, indurated, and enlarged. Finally, annual doctor exams are essential for patients as they begin to grow older or have significant family or personal medical history. Now let's discuss who is at risk for prostate cancer. A risk factor is anything that increases your chances of curing a disease or making you more susceptible to disease. All men are at risk for developing prostate cancer, especially men over 50. 1 in 6 men will be diagnosed with prostate cancer in their lifetime. The older the male is, the more likely they are to develop prostate cancer. African American men or men with a family history of prostate cancer are also at a higher risk to develop prostate cancer. Typically, men who are diagnosed at a younger age have a more severe or progressive type of prostate cancer. On this next slide, we list a few more risk factors that have been linked to increased risk of prostate cancer. Please take a moment to review the slide. On this slide, I have listed a few eye-opening facts regarding prostate cancer. One that stood out the most was that prostate cancer is more deadly than breast cancer. One statistic is known that out of 100 American men, 13 men will be diagnosed, and 2 to 3 of those men will die from prostate cancer. With that being said, primary prevention and education is vital to our male population. The signs and symptoms of prostate cancer are listed here on the slide. However, prostate cancer often presents itself asymptomatically. Difficult and painful urination, as well as blood in the urine, are often the most common symptoms men notice. Again, please take a moment to review the signs and symptoms of prostate cancer. Again, 1 in 6 men will be diagnosed with prostate cancer in his lifetime, which affects many men in the United States, which is why I chose this topic, because it has personally affected my family. My granddad had prostate cancer, and most recently, this past month, my dad was told that he more than likely had prostate cancer as well. He was sent to an oncologist in Birmingham, where he had to undergo multiple biopsies. However, fortunately, his prostate is not currently cancerous, but he will have to be checked and screened every 6 months. This is the reason I've created a DNP-led healthcare initiative to provide awareness to men about prostate cancer. My plan is called POP, or Protection of the Prostate. Let me share with you my plan. POP is an interdisciplinary plan created to prevent prostate cancer, provide awareness, and establish screening and early detection for men. This will be a community-based plan in which we will partner with local health department and local companies in our community who primarily employ men. The DNP leader, medical assistant, nurses, and lab techs from my community clinic will work collaboratively together to go into these health departments and companies throughout the community to provide in-service meetings, providing lunch as well for those who attend as incentives so that these men will be able to hear and learn about this disease. This will be a community-based project, choosing one site in the community, a health department or a company once a month for a year so that we can reach as many men as possible in our community. The goals of the POP program are listed here on this slide. Please take a moment to review these goals. These in-service meetings will be separated into 2 sessions with a catered lunch provided in between. In these sessions, the DNP leader, along with all the med assistants, nurses, and lab techs, we will discuss the POP program. Its goals: provide an overview of prostate cancer, discuss risk factors and signs and symptoms of prostate cancer, provide resources for the men, and provide resources for the men. Session 1 will begin with a pre-assessment tool to evaluate the participants' knowledge of prostate cancer prior to the in-service. After the assessments are completed, we will then begin to educate the participants in detail on basic knowledge of the prostate and prostate cancer. We will explain the POP program, its purpose and goals, before continuing into Session 2. In Session 2, we will move further into the topic educating the patients on risk factors and signs and symptoms of prostate cancer. We'll explain why the POP program is important and needed to provide participants with the next steps to take and resources for screening to establish further care at the end of the session. A post-POP in-service evaluation, or PI, will be used to evaluate the participants' new knowledge of prostate cancer and evaluate effectiveness of the POP program. In addition to the evaluation, at the end of the second session, there will be a time allotted for questions and concerns from participants. The post-POP in-service evaluation will allow the DNP leader and staff to evaluate the impact of the POP program and allow for revisions and adaptations to the program in order to better educate and serve the community. The post-POP in-service evaluation will be a series of 10 questions, like the pre-assessment, which will interpret participants' understanding of prostate cancer and identify their own personal risk factors. At the end of the evaluation, a small area will be provided for participants' input on the POP program, with any suggestions welcome. On this slide, I have listed several resources that I will refer to my participants so that they have reliable resources to further explore this disease and to help answer any questions they might have after this in-service. This interdisciplinary community-based program, POP, utilizes primary prevention strategies. In order to educate its participants, the goal of the primary prevention in this setting is to educate the participants and prevent the disease from ever occurring by educating its patients on risk factors, signs and symptoms, and steering them towards early detection. Please take a moment to review the strategies listed on this slide. After educating participants on prostate cancer as DNP leader, I think it is vital to the male population that we lead them to their next steps and help them establish their next step on this slide. I have listed the next steps here, which the DNP leader will have interpreted into a small pamphlet to pass out at the end of the session. The DNP leader and staff who developed and implemented this plan, the POP program, demonstrated learning capacity, diversity, integrity, community, and influence throughout this project. Other leadership competencies of this program are listed here. The foundation competencies of this program, which are utilized and instilled throughout the entire program, are communication, integrity, and relationships, which are essential to the success of this program. Communication skills during this program is essential. Communicating with participants, vendors, health departments is required for the success of this program. Relationship building plays a major role between the DNP leader, staff, and participants. Creating relationships with participants creates a comfortable and trusting environment and a willingness to learn. Therefore, integrity serves a vital role as the DNP and staff make relationships with their participants, establishing rapport and being honest in a professional manner. In summary, prostate cancer is the second most common cancer among men in the United States. 1 in 6 men will be diagnosed with prostate cancer at some point in their life. We can reduce and modify risk factors by educating men on the risk factors, by educating the community on prostate cancer. Educating is essential to ensure screening and early detection of prostate cancer. POP program has been created and designed by a DNP leader in order to ensure education to men throughout our community. References will be listed on the next 2 slides.